How Diet Affects Asthma by Anna McIntyre. Before I get into the small details about asthma and how the diet affects it, I want to show you a short news story where a study says that new diet may improve asthma.
Out today that could help you breathe a little easier.
And joining us now with what's on the menu for the asthma diet, health anchor Liz Bonus. Liz.
Hey guys, breathing is good. People like to breathe. Asthma is a condition, as you may know, that causes your airways to constrict, which can make it hard to breathe. A new study, however, on a diet found that it can make a difference when it comes to opening those airways up. Since poorly controlled asthma is defined as needing rescue medications quite often, what's on this menu might matter. It is that time of year. Already, Dr. John LeCount says his office has been very busy.
We're seeing quite a bit of illness.
Several viruses are already going around, and so are allergy complications.
But we also see the respiratory types of things, so the cough, the congestion, the cold, the runny nose, itchy eyes, those types of things. And those are a combination of sort of allergies as well as just upper respiratory infections.
All that can make asthma symptoms even worse if you have this condition. Medications are often needed to help you breathe a little better, but a recent study in the European Respiratory Journal also found diet can make a difference. Researchers looked at more than 34,000 adults who ate plenty of fresh fruits and vegetables, as well as whole grains, nuts, beans, fish, and olive oil. These reduced asthma symptoms, and many that ate them needed fewer rescue medications compared to those who did not eat this way. Researchers speculate that these healthier food choices promote healthy balance in the body that can help good bacteria show up in the intestines, which can reduce inflammation.
What is asthma? Asthma is a condition in which your airways narrow and swell and may produce extra mucus. For some, it is a minor nuisance. For others, it can be a major problem that interferes with daily activities and may lead to a life-threatening asthma attack. To put it into perspective, 1 in 13 people have asthma, and more than 25 million Americans have asthma. So, what symptoms do asthmatics experience? Some include shortness of breath, chest tightness or pain, wheezing when exhaling, trouble sleeping, and coughing or wheezing attacks that are worsened by a respiratory virus. Some signs that your asthma is worsening include asthma signs and symptoms are more frequent and bothersome, increasing difficulty breathing, and the need to use a quick relief inhaler more often. What actually is the cause of asthma? Well, it isn't clear why some people get asthma and others don't, but it could be due to a combination of environmental and genetic factors. For some people, asthma signs and symptoms flare up in certain situations, such as exercise-induced asthma, which may be worse when the air is cold and dry, occupational asthma, which is triggered by workplace irritants such as chemical fumes, gases, or dust, and lastly, allergy-induced asthma, which is triggered by airborne substances such as pollen, mold spores, cockroach waste, or particles of skin and dried saliva shed by pets. Exposure to various irritants and substances that trigger allergies can trigger signs and symptoms of asthma as well. How exactly is asthma diagnosed? Be diagnosed by first performing a physical exam, where your doctor will perform an exam to rule out other possible conditions. Next come the tests to measure lung function. You may be given lung function tests to determine how much air moves in and out as you breathe. 2 types of tests may be performed. The first one is spirometry, which is a test that estimates the narrowing of your bronchial tubes by checking how much air you can exhale after a deep breath and how fast you can breathe out. Second test is a peak flow test, which measures how hard you can breathe out. Lung function tests are often done before and after taking a medication to open your airways called a bronchodilator, such as albuterol. If your lung function improves with the use of a bronchodilator, it is likely you have asthma. What solutions are currently available? While asthma can't be cured, its symptoms can be controlled. Current solutions include change in diet, adding an exercise regimen, adding a medication regimen, and changing your environment. My main focus is change in diet. So why change diet? What are the benefits? Well, it has anti-inflammatory effects on asthmatics, lowers airway inflammation, reduces neutrophils, and supports microbiota composition. So, what is so bad about the Western diet then? It has pro-inflammatory effects on asthmatics, alters microbiota composition and potentiates inflammation, causes an increase in airway inflammation, and causes a higher eosinophilic airway inflammation. So what's the main difference between the Mediterranean and Western diet? The Mediterranean diet is high in fruits and vegetables, has a focus on whole grains and plant-based foods, and has moderate amounts of dairy, poultry, and eggs. On the other hand, the Western diet has a focus on highly processed foods and low intake of fruits and vegetables. It is also high in refined grains, processed and red meats, and desserts. In order to gain additional insight into this disease and how my proposed solution could help asthmatics, I've interviewed my mom, Cecilia McIntyre, who suffers from asthma firsthand and is also a registered nurse. I will play the interview for you now. Hi, I'm an NC State student taking an advanced genetics class focusing on energy balance and how it impacts our health. My project is focusing on asthma and how diet affects the disease. It is known that a Western diet exacerbates the symptoms of asthma and a Mediterranean one alleviates them. I selected this topic because I know several people, in particular my mom, who suffer from this disease, and I know firsthand how it can affect a person's life. So let's start by introducing you. What is your name and why are you considered an expert on asthma?
My name is Cecilia McIntyre. I am self-considered an asthma expert because I myself have had asthma for about 20 years. I was diagnosed as an adult, so I've had plenty of experience with dealing with this whole body issue, and because it affects more than the lungs.
How does asthma impact your life? How severe is your asthma?
My asthma is controlled, so it's not considered severe except when I have exacerbations. And I have gone a year or 2 years without exacerbations, but then again, I have put in the hospital multiple times during a year for exacerbations. So it's stable until it exacerbates.
Okay. How does it impact your life, like your daily living and long term?
On a normal day, I do great. When I have an exacerbation, I can't do anything because I can't breathe. When I'm in an exacerbation, it affects every part of my life.
Okay. Do you feel like asthma is misunderstood? What would you like people to know about asthma and living with the disease?
People don't understand that it's not just a lung disease, it's a total body disease. It affects other organs because you have asthma. It affects your diet because there are certain things that are proven to exacerbate asthma. You're talking about the Mediterranean diet versus a Western diet. A Mediterranean diet is highly recommended because asthma in itself is an inflammatory response. And if you eat something that is also an inflammatory response foods, it's difficult for the body to process, and it causes inflammation inside the cells, and that's just a proven fact that certain foods do.
Have you ever experienced the Mediterranean versus Western diet scenario? Were you ever advised to change your diet?
I have been advised to change my diet. Every time I am admitted to the hospital, I am placed on the Mediterranean diet. It is listed as Mediterranean diet.
You have been advised to change your diet when you go to the doctor or get put into the hospital?
Yes, I've been advised, not only because of my weight, but because of my asthma also.
Yeah. What solutions other than the change in diet have your doctors suggested as treatments?
They have, of course, medication is the top line of choice for treating asthma. And they have advised me to increase my activity. as I can.
Do you feel that the diet and exercise is more of a long-term lifestyle change? It's not as simple as medication, so that's why a lot of people opt for it.
I do believe
Changing, yeah.
it requires a mental change in lifestyle, a lifelong change in lifestyle, but it does help. But you're going to always have to take your medications, so that's
always there. So do you feel like the diet not only helps the symptoms of asthma, but helps the side effects of the medications that you get put on?
yes, I believe that. I wish somebody would come up with a drug.
Well, you've answered all of my questions. Thank you so much.
Wonderful. You're welcome. You have a great day.
So, why should you support the solution? Like she just said, asthmatics wish there were more options. Funding this solution will allow for more than 25 million Americans to alleviate their symptoms and experiences with asthma. This solution should be funded $100 million due to the fact that asthma is such a widespread disease. I can almost guarantee that each person in this room knows someone directly affected by the disease. Because of this, I feel that funding solutions could bring widespread benefit, and the new solution would have a good market to do well in.